Welcome to the Medcurity podcast. Let's dive right in and chat about something that might not be the most glamorous part of healthcare, but is absolutely critical when seconds count. How HIPAA adapts in emergency situations. Picture this, a major accident, a natural disaster, or even a chemical spill, where rapid decisions are key and every moment counts in saving lives. Today, I want to share some real-world insights on how HIPAA isn't a roadblock in these critical moments, but instead has built-in flexibilities that let healthcare providers act quickly without abandoning patient privacy. So here's the deal. We all know HIPAA's main goal is to protect patient information. Under normal circumstances, that means strict rules about who can see your health records and under what conditions. But emergencies are different. Imagine you're rushing a patient from one facility to another after a traumatic event. There's no time to sit around asking for permissions or filling out a ton of paperwork, and that is where HIPAA's treatment exception comes into play. In these urgent scenarios, healthcare providers are allowed to share the information that's needed for treatment, even without the usual formalities. This exception is designed to ensure that when a patient's life is on the line, doctors and nurses have access to the crucial details they need to act fast. Now, you may be wondering, doesn't that put patient privacy at risk? It's a fair question. The key here is the idea of sharing only what's absolutely necessary. Even in an emergency, providers are expected to limit the information they share to what's needed to deliver care. The minimum necessary rule ensures that while the system is flexible enough to let life-saving communication happen, it's not suddenly a free-for-all where every detail is exposed. Let's break it down with an everyday example. Imagine a scenario where a patient is rushed into an emergency room after a serious car accident. The patient might be unconscious, so they can't give consent to share their information. However, the medical team still needs to know the patient's history, like allergies, medications, or past conditions, to provide effective treatment. Thanks to HIPAA's provisions, doctors can access and share that essential information with other specialists, nurses, and even with family members who are there to support the patient. The idea is simple. In these moments, getting the right information quickly can be the difference between life and death. Another important aspect is the allowance to notify family or caregivers. We all know that emergencies can be overwhelming, not just for the patients, but also for their loved ones. If someone is in critical condition and can't speak for themselves, HIPAA permits healthcare providers to share necessary information with designated family members or caregivers. It might be as straightforward as letting a spouse know that their partner has been admitted to the ER and is receiving treatment. This isn't about spilling all the details, but rather about ensuring that the right people are in the loop when every minute matters. Now let's talk about public health too. Sometimes an emergency isn't just about one person. It affects entire communities. Imagine there's been a chemical spill or an outbreak of a serious infection in a local area. In such cases, HIPAA allows healthcare providers to share critical information with public health authorities and law enforcement. The goal here is to quickly identify and manage the threat, preventing further harm to the community. It's a delicate balance. On one side, you have the need to protect individual privacy, and on the other, the necessity of rapid information sharing to safeguard public health. You might recall how those flexibilities were put to the test during major events in the past. Take Hurricane Katrina in 2005, for instance. Records were scattered, and patients had to be moved quickly from one facility to another. In that chaos, the treatment exception allowed providers to share vital patient information without getting caught up in red tape. This helped ensure that patients received continuous care, even when they were transferred between facilities. And similarly, during Hurricane Harvey in 2017, hospitals activated their emergency protocols, and in doing so, they were able to leverage temporary waivers of certain HIPAA requirements. These waivers, authorized by the Department of Health and Human Services, meant that some of the usual procedures, like obtaining explicit permissions, were relaxed for a short period, allowing healthcare teams to focus on what really mattered: patient care. Now, you might be thinking, that sounds great in theory, but what about the digital side of things? And that's a crucial point, because even in emergencies, cybersecurity doesn't take a back seat. Healthcare organizations must still protect electronic patient records and ensure that any information shared is done so securely. Even when you're acting fast, using secure methods to transmit data is non-negotiable. Hospitals often have contingency plans, backup systems, and secure communication channels in place. Even if a waiver temporarily relaxes some HIPAA requirements, the underlying expectation is that patient data remains protected from unauthorized access. In today's environment where cyber threats are constantly evolving, it's more important than ever to integrate robust cybersecurity measures into your emergency response plan. So what does all of this mean in practical terms for healthcare organizations? It boils down to preparation and training. First, you need to have a well-crafted emergency plan that explicitly addresses these HIPAA flexibilities. This means outlining who can share what information, under which circumstances, and through what channels. A clear plan can prevent confusion when a crisis hits and ensure that everyone is on the same page. Regular training is also key. When your team is familiar with these exceptions and understands the rationale behind them, they can act decisively and appropriately during an emergency. You want your staff to feel confident that they're doing the right thing, even if that means deviating from standard procedures for a short period. Another tip is to integrate cybersecurity into your emergency planning from the very start. Think about your IT systems as the backbone of your emergency response. Whether you are accessing patient records remotely or coordinating with other facilities, these systems must be secure and reliable. Invest in robust backup solutions, secure networks, and disaster recovery plans. Not only does this protect your patient's data, but it also ensures that when a crisis hits, your team isn't hindered by technical issues or data breaches. There's also a point to be made about the role of state-level regulations. While our focus today is on federal HIPAA guidelines, it's worth noting that some states have their own rules that can be even more stringent than HIPAA. In practice, this means that in an emergency, healthcare providers need to be aware of local regulations that might affect how information is shared. A good rule of thumb is to always follow the stricter standard. That way you are covered both federally and locally. It might require a bit more homework before an emergency hits, but that is a small price to pay for ensuring that your processes are airtight. Now let's imagine a couple of scenarios to put all of this into perspective. Picture a larger hospital that suddenly experiences a mass casualty event like a major highway accident. In that moment, the hospital activates its disaster protocol. Staff quickly start sharing key details, patient names, conditions, and treatment needs with other hospitals and emergency services. This information is shared under the treatment exception, meaning that while full medical records aren't being broadcasted, the essential data is available to make informed decisions quickly. The minimum necessary rule is still in play here. Only what's absolutely required gets shared. Once the immediate crisis is handled, the hospital reverts back to normal HIPAA procedures, ensuring ongoing privacy. Now imagine a different situation, where a hospital is dealing with an influx of patients due to a chemical spill. Time is of the essence, and healthcare providers need to inform public health officials and law enforcement about the situation. Here, HIPAA allows providers to share information with those authorities so that they can initiate a broader public safety response. The information might include the nature of the exposure, the number of patients affected, and any immediate risks to the community. This isn't a case of bypassing privacy protections. It's a measured response that acknowledges the need to protect the broader public while still minimizing unnecessary data exposure. Now, as we wrap up, here's the big takeaway. HIPAA's emergency provisions aren't about cutting corners on patient privacy. They are about striking a balance between protecting individuals and ensuring that life-saving care isn't delayed by administrative hurdles. In a crisis, every second counts, and having the flexibility to share critical information can make all the difference. That said, it's crucial to remember that these flexibilities are temporary. Once the crisis subsides, the normal HIPAA rules resume, and all the usual safeguards must be reestablished. It's a system designed to be both compassionate and pragmatic. Do you know exactly how your team should handle patient data during a crisis? Are you confident that your cybersecurity measures are robust enough to protect that data even when time is short? These are important questions because preparedness isn't just about having a plan on paper, it's about being ready to act when the unexpected happens. To recap, in an emergency, HIPAA allows healthcare providers to share essential information quickly, whether it's for coordinating treatment, notifying family members, or alerting public health officials. The law provides clear exceptions and temporary waivers that help ensure that patient care isn't compromised by bureaucratic delays. And while these rules offer flexibility, they also reinforce the need for secure data practices and thorough planning. By staying informed and prepared, you can navigate the challenging balance between rapid response and patient privacy with confidence. Thank you for spending this time with us as we unpacked how HIPAA is flexible in emergencies. I hope you found the discussion insightful and that it gives you a clearer picture of how to approach crisis situations without sacrificing the trust and security that patients expect. Stay safe, stay secure, and until next time, keep pushing forward in your mission to provide top-notch healthcare while guarding the critical data that comes with it.